And we welcome you back to our program for today, and a medical topic for our next segment on the program. We are talking again today with Masheed Farmand, DDS, and we welcome you back to the program. Good to have you with us on the show today. The practice of dentistry obviously has evolved over the last few thousand years. No longer do we give people alcohol to drink and then strap them in the chair. We make it a little less painful these days. You brought along one of our neighbors here in Laguna Woods, one of your patients. If you'd introduce her, please.
This is a beautiful, nice lady, Mrs. Foster.
Joann, welcome to the show.
Thank you.
Good to have you with us today. You know, a lot of us are taking, as we get older, doctors prescribe all kinds of things for us. It could be for blood pressure, it could be for other medical conditions that we may have, and a lot of ladies I know are concerned about something called osteoporosis. Lots of medications on the market. Some you have to take, and I know a friend of ours takes one and she has to stand up and walk around for a half hour, you know. And some, there's one on TV that some famous actress is promoting you only take once a month. There's a variety of those. In your practice, you've come across some ladies in our community that in fact are concerned about osteoporosis and are also concerned that it might impact the dentistry work.
Yes, Rob. Osteoporosis is a very common disease in the population right now, and I was reading somewhere there are 22 million prescriptions written between March 2003 and April 2004 for osteoporosis. The medication was called bisphosphonate, and Fosamax is the brand name,
yeah.
Yes. And a lot of people, they were just asking, you know, am I a candidate for an implant because I'm taking this medication? And what I did a lot of researches, and you know, I read a lot of articles, and it's actually a brand new thing right now. And there were some cases reported, but worldwide there are only 170 cases reported as you know. Like a complication happened after the injury or any insult to the, to the bone. And I have a live example here. Mrs. Foster came to me.
A live example.
Yes. Well, you had been taking, I believe you said, for 8 or 10 years.
10 years,
okay.
Yes.
Prescribed by your doctor to help
Yes.
not have a problem with brittle bones, which is what osteoporosis is. And while that's a good thing to do, is to deal with that problem, you had a concern, and you had done some of your own research, I understand.
Yes, I searched for almost 6 months for a dentist that I felt was knowledgeable enough to do an implant, because so many dentists do them, but they'll do the first part and then send you someplace else for the implant. And many of them didn't know about the Fosamax problem. And so I finally found Dr. Farman, and I had a free consultation, and my husband and I were both so impressed with what she had. The one thing is that when you go in, before she even decides if she can do it, she takes the panoramic x-rays in her office, so she would know right away if I was a candidate for this. And I did not have a bone chip put in when the tooth was pulled about 2 years ago, and that was a problem. So she knew how to take care of that. The nerve was higher to the surface, the bone was narrow, and it makes me shudder to think if I had gone to some other dentist who didn't really know about these problems and what could happen. And my husband was so sold with Dr. Farman, not just because she's so pretty, but just because she's so good, that we're both seeing her for everything from cleanings to, well, we hope that's the word, that's the most,
yes.
But for everything.
Good prevention.
And my brother also was impressed with what I told him, and he had Dr. Farman do an implant for him.
Well, it sounds like then with the right dentist, with the right work, and the right research, implants are possible, even if someone has been taking certain products?
Actually, what fosamax or bisphosphonate does is that it's fighting against osteoclast cells, which are the cells responsible for the bone resorption. So then the resultant bone is more sclerotic, but it's poor in the supply, so blood supply. So what's going to happen is any injury or insult to the bone can cause complication later. So they call it necrotic bone or dead bone. A lot of people, they heard about that. So, but it's so rare, and it's so it's not so. I would say we just need some time and some more reports and more studies going through this.
So I guess the message out there to the public is, if you are on some of these products to help fight osteoporosis, you still might be a good candidate for an implant, and they should come talk to you, somebody with the qualifications and background on that, and find out if it in fact works for them. That's interesting. Obviously when you take a medication like that, it's going to work on, you can't make it be selective. Just work on the hip bones and the arm bones, for example. It works on all the bones in your body, and of course our jaw is a bone. So
I would like to emphasize that it's very important to complete the medical history form and inform your dentist about all the medications that you're taking. There are a lot of patients, they say, oh, that's not important to you, it's not even related to your job. It is, and I need to know, and with proper pre-op and post-op care, we can manage that, like hair case, and no
That's
problem
great.
with implants.
Sounds like you're happy with the results.
I'm very happy. It's so nice to be able to chew on that side, and I'm really glad that I found her and that I had it done.
And you've shared that with family and friends, it sounds like, as well.
Oh, yes.
Which is good.
Yes.
Thank you very much. You're still accepting new patients. If people want to come see you, you're available?
Of course, of
Good.
course.
Good. They can give you a call over there at the office and find out more, and get involved as well. We thank you both for joining us today. Sounds like some good information. If you've been told that you might not be a candidate for these type of procedures, get a second opinion. Talk to the nice folks over there at Brilliant Smile. Find out more about that. Thank you for joining us, Doctor. Thank you for joining us today as well. Good to have you both with us on the program for today.